Well, a very warm welcome back to the International SOS series on return to operations and return to travel across the COVID-19 environment. I'm very pleased to be joined in this series by a new set of specialists from around the world today. And I'd like to introduce them. Firstly, Dr. Anthony Renshaw, based in Europe, Dr. Nosa Ahi, based in Dubai, and Sally Llewellyn, a security specialist based in Dubai as well. What we'll hope to do over the next 15 or so minutes is take you through, again, a different perspective of some of those challenges and recommendations that we're seeing across these regional theatres relative to the return to operation. So let's get straight underway and have a look at where we have been over the last week relative to COVID-19. You will all be very appraised of the fact that there's been enormous changes on a global basis and some indications of second wave situations and growth in the number of cases in areas that we've seen declines previously. So firstly, let me hand over to Dr. Anthony to take us through a review of the last week of COVID-19.
Thanks a lot, Mike. You know, it's quite clear there's very important milestones that have taken place this week. First of all, we've hit over 10 million cases this week with over 500,000 deaths, with, I think, some clear indication that there's some now new hotspots that have emerged over the last couple of weeks that are still on the way up. Latin America in particular, Brazil, Mexico, Peru, all reporting increasing numbers of cases, and the United States also forming a large proportion of the cases and deaths now. Some of the states have indeed had to pause some of their reopening, Texas in particular, because of increases in cases. And across Europe, on the other hand, there is indication that increasing numbers of countries are now waning. And we have added countries like Switzerland and Finland to the mix over the last couple of weeks. And so gradually these countries are opening up air bridges between each other. For example, in the UK, there will now be an ability to travel to other parts of Europe. What will this lead to in the coming weeks? We don't know. In terms of research, also a lot of progress being made. For a start, the dexamethasone study here in the UK has shown some promise, leads to a reduction in deaths. It's the first study that's shown that, but we need to really wait for more data to come before celebrating too much. But if this is the case, this could be quite a significant game changer. In terms of vaccines, also a number of trials progressing. There's the Oxford trial, which is progressing here in the UK, been extended to South Africa and soon in Brazil and the United States, and a couple of other very promising vaccines. But irrespective of how promising these are, I think it is very much in the long haul. We can't expect anything to be ready for some time.
Thanks very much, Dr. Anthony. A very good overview there. Thank you. Let's move across to Dr. Nosa, if we could, and clearly understanding with your remit across the Middle East, Africa, there are an enormous range of different levels of this curve being undertaken and experienced. How are organizations within your region responding to these challenges, and how are we supporting them in that return to operations agenda?
Thank you very much, Mike. As you well know, within the Middle East and Africa, there's different challenges for different countries. And I think probably the biggest challenge we face or our clients are facing is with regards to the availability of testing. In many places in Africa, we are seeing the testing capacity is well under 1% of the population. And then in Middle East, again, we see some countries where testing has been quite impressive. For example, in the United Arab Emirates, they have tested over 30% of the population. So it's been quite a mixed bag here in the Middle East and Africa. Again, we're also seeing a lot of challenges when it comes to implementing, the recommended quarantine periods. This is more so for our offshore clients, who require, rapid crew change, keeping people for 14 days, and within those 14 days, making sure that they are remaining safe. It is also been a big challenge. And I think one of the very major challenge that we really need to focus on has been the psychological impact that remaining in in many countries have had on our clients. For example, some of our clients have been in country for over 4 months now just because of the travel restrictions. They've not been able to move their employees back home, and we're having a lot of having to support a lot of these individuals from a psychological point of view. So the travel restrictions have has opened up quite an interesting prospect with regards to that. So we've helped a lot of our organization understand exactly what the testing requirements are, how again to be very smart about this process, because a lot of clients have come to us to say, look, how can we actually shorten this quarantine period? Again, there's a lot of local legislation to understand. And again, you have to look at the different kinds of testing that is available in this environment. A lot of the countries we operate in, especially here in the Middle East, have banned the rapid diagnostic testing, which many thought would have helped in screening employees going back to work, and they are doing only the PCR testing. In many of the African countries, the PCR testing is definitely not adequate, and also getting this available to them and the turnaround time for the testing is something we've helped them to understand going forward. So the biggest challenge has been the testing and how to get their workforce fit again to return back to their activities. Over to you, Mike.
Very clear. Thanks very much, Dr. Nosa. Just moving forward, I guess, and staying on the medical side, I mean, clearly from an assistance point of view, we're continuing to provide medical assistance, evacuations, and some of that return to operations and rotational support to clients across Africa. If I can go to Dr. Anthony again and just go and have a look at the European situation. Dr. Anthony, you've been working with some key clients across the European environment, and especially regarding their addressing a de-escalation agenda. Can you just help us understand a little bit of the key challenges that they've had in that space, and where are we focused in terms of that support, and what can we do to support clients in that environment?
One of the key challenges, and we've seen this from the start of this crisis, is where do you get your information from? There is such a lot of inconsistency across Europe in particular, with different countries having their own a way of dealing with the de-escalation in particular. We've seen here in the UK, there'll be a move from the 2 meter rule to the 1 meter plus rule in a week or so. Now, that is quite different to what we've had previously and differs from other countries. And so we've been trying to help our clients understand, well, what's the implication going to be for us for moving to the 1 meter rule? Other issues include things like this question of immunity. We are all very interested in what Dr. Nosa was mentioning about antibody testing, but do we really know what antibody testing is going to be able to achieve for us? I don't think that answer is yet with us. We also are facing challenges of what we're calling COVID myopia. This is this kind of notion that we're spending a lot of time here talking about COVID-19, and that's very understandable. But what about how do we address the burdening of mental health issues, or the fact that people aren't getting screened for cancer anymore in the same way as they were before? These are very important questions for a company to understand, because actually there's quite a lot that some companies can do about that. And then finally, the question of the second peak and the second wave has been quite confusing. We're seeing that early start to a second wave in countries like China and South Korea are also reporting some increasing cases. Now, I think we're not necessarily in a second wave yet in lots of countries. In a lot of cases, we're actually still in that first wave. And it was only really China that I feel might meet the definition for a second wave, because of course there were no cases reported in Beijing for a very long time. That's not the case in countries like Sweden and in the United States, where we're again seeing another peak, but it's still very much part of that first wave. So how do we understand what the future lies? This is a very important question that a lot of our clients are asking at the moment.
Thanks, Dr. Anthony. I really appreciate that. That's a very interesting view. Let's stay in that key area of information that you discussed just now, because this is clearly Sally's area of expertise. And let's go back to Dubai. So Sally, can you help us understand from your point of view, with supporting clients around the return to operations, how are the security teams working, collecting information, how we're making that available, and what are the key areas that you're seeing your clients requiring and asking of you?
Thank you, Mike. It was actually really interesting listening to Dr. Anthony talk about the challenges from an information perspective, because that's absolutely been the key theme for our clients and for our security teams here at International SOS. Over the last few months, we've been monitoring 24/7 and updating our clients on various restrictions associated with border closures and internal movements. That's been really key to supporting our clients through this phase. But that information has been hugely challenging to find and very challenging to serve to our clients in a way that is easy to use. And I think that will become even more complicated than it has been. So now that we're seeing some of the easing in restrictions in particular countries, it's actually much harder. It's very, very dynamic, and the situation changes so rapidly. It's difficult to understand what's going on in Europe this week. It will all be about air bridges and air bubbles, as Dr. Anthony mentioned. What does that mean for quarantine requirements? Does that mean that it's time to open up for travel again? What are the risks in particular locations? So accessing the right information about what the restrictions are, who's impacted, and what the quarantine requirements are is really important to our clients and such a fundamental portion of our service. At the same time, sort of elsewhere within our team, we're very much mindful of ongoing security environments and the impact that COVID has had on some of the more complex security challenges. So here in the Middle East, I'm thinking about conflicts in Yemen, in Syria, and in Iraq, and how those have been impacted in the COVID situation. There's been dynamic changes in those environments over the last couple of months, and it's really important for us to be able to support our clients in understanding when they're rotating workers in and out of those environments, as Dr. Nosa spoke of. What are the security implications, and what are the plans that need to be in place to support people moving in and out of those very challenging environments? The other key thing, I think, from talking to security peers in our client organisations is how we have the right level of support to our decision makers, making really tricky decisions about their businesses and COVID impacts on those businesses. So how do we support and be an enabler for business in a very, very challenging environment? And from a security perspective, that's supporting our businesses in understanding what the legal requirements are in particular countries, what is going on in border closures, but then also that overlay of some of the difficult security challenges that we've seen. Pretty significant protest activity, really globally, which has changed some of the more lower risk environments where previously our clients would have had lower concerns from a security perspective, and supporting our clients and our security peers in helping their decision makers make effective and clear decisions in a really, really challenging information environment is such a key theme for the security community at the moment.
Yeah, very clear. Thank you, Sally. So having reviewed those challenges that organizations are facing, when we look at the return to operations, return to travel environment, clearly all of our clients are developing policies and processes that will help guide their organizations through this next phase that we are starting to emerge. So let's have a look at recommendations. And if I can come firstly to Dr. Nosa again, from a Middle East Africa point of view, Dr. Nosa, how are we guiding our clients in terms of these recommendations, and where would you position this in your approach?
Thanks, Michael. It's very interesting that we've talked a lot about travel inter-country. I also want us to look at it from travel in country, because I think most of the travel is going to occur within the countries, and a lot of these will be guided by the local regulations. So if we look at it in 3 phases, let's say before you go to the office or pre-entry into your workplace, and you look at it at your workplace, the activities around your workplace, and then also look at a very important third aspect, which would be what to do if any of your employees get infected, with COVID-19, or just have a robust health plan. So looking at pre-entry, so we're looking at advising people to have very effective communication with your workforce. Let them know what the expectations are or what the expectations would be when they get back to the work place, helping them to understand exactly what the local regulations are saying in terms of traveling, the number of people in your transport. Are you providing a specific transport? Are your people taking public transportation? Then again, is also the accommodation, because one of the things we have seen is for an effective control, you need to have something like a closed bubble where you control both from your work site to the accommodation. So you have different kinds of accommodation. There are shared accommodation, personal accommodation. That's also something to look at, in terms of curtailing the spread of COVID-19. Then also the travel to work, you look at your entry points, in your office, especially the high touch areas. We've advised on using different recommendations on how to clean, how to keep safe, how to rearrange, your office space in terms of social distancing, how to also change people's behavior, because again, it's just going to be a lot of reinforcement. I think the biggest issue is people's behavior. You can have all the recommendation, but it needs people for it to be implemented. Then also talking about your post-exposure plan. If somebody gets infected in the office, how robust is your system in terms of isolating in the office and then informing the proper authorities, and then your duty of care going on and following with that individual who gets infected. So we try to advise, it has to be a holistic approach. It has to be an end-to-end solution, because if any of these points gets broken, then there's the risk of exposure, to your business. Over to you, Michael.
Great, thank you, Dr. Nosa. Let's go across to Europe and ask Dr. Anthony recommendations on your side relative to keeping our clients in a safe place with preparing policies and procedures.
If we stick to the return to travel piece, which I think is the most topical thing in the last couple of weeks here in Europe, if we split it into the sort of the primary challenges, the risk of infection or the direct risk of COVID, there's a number of things that you can do to try and prevent that in the travel side, whether it's issuing masks to people or giving them guidance on how to prevent infection. But also, I think one of the most topical things at the moment here in Europe is the pre-existing condition. There are certain vulnerabilities that perhaps need to be looked at a little bit more carefully for that traveling population. And we're working quite closely with organizations on what that looks like as our understanding evolves. Then there are the secondary challenges, the access to care for COVID, and that depends on the country and the healthcare system capacity issues. A number of countries at the moment are facing some challenges within regions or within particular cities, and it's very important to understand that before traveling. We also need to understand testing capabilities and access to drugs. Some countries are only allowing access to certain drugs to people, perhaps not the drugs that we think are a little bit more effective than others. And then the tertiary challenges, those sort of non-COVID related issues, access to care for non-COVID, very important. The ability to medically evacuate somebody from a country, that is also very key consideration when we look at the return to travel piece. Over to you, Mike.
Lovely, thanks, Dr. Anthony. So from that medical point of view, once your organization has prepared themselves around understanding the medical exposure and whether they're traveling on a local basis, a regional basis, or internationally, once you've looked at those considerations around the recommendations for supporting your employees within the environment they're going to be traveling to, and what should they be do relative to protection, as well as then either COVID or non-COVID transportation on that side. Let's go to Sally and have a look at the security side, because very clearly, as Sally highlighted earlier on, there are another layer of exposures and risks that we need to assess relative to preparing your workforce and ensuring that they're balancing not only the immediate medical COVID-19 risks, but what are the background security issues as well and information they can get. Sally.
Thanks, Mike. I think in terms of recommendations, I'd make two points. I think access to information, which I'll talk about in a moment, but also revisiting former escalation plans is really important. So in the last few months, there's been a real strong focus within the security community on business continuity planning and crisis management, which is incredibly important and has certainly been through this most recent phase in this crisis. Now, when we're talking about returning to travel, returning to operations, our clients are looking to when can they rebuild their operations, when can they stand back up again in potentially complex environments. They've probably still maintained a presence throughout this crisis, but perhaps at a lower level than normal, and now they're looking to get back up and running at full speed. It's really important to go back and revisit some of those initial escalation plans. In high-risk security environments, most of our organizations have very robust security plans. Unfortunately, they haven't always, in the last few months, kind of met the requirement because they relied quite heavily on an evacuation option. So how can we build into plans better stability and support in country should things start to go wrong? Should we see a further return to restrictions in something like a second wave? How can people be supported actually in country from a resilience perspective going forward? It's very important to revisit some of those initial escalation plans. This has been an interesting topic, not just COVID related, but in some of our lower risk environments. We've seen over the last 12 to 18 months a high level of interest from our clients in Hong Kong, which was always perceived to be a very low risk environment from a security perspective. Protest activity has made us sort of revisit some of that escalation planning and how we can support our clients best in low risk environments. And I think the next focus for that will be in Europe, where we see clients returning to travel or returning to operations, but actually needing to have a more traditional escalation plan to be able to support rapid changes in the environment. So quite a challenging one for security professionals to get on top of. Returning to the information piece, that's of course the other key recommendation, is having reliable access to trusted information on a 24/7 basis. I feel very fortunate that I've got my colleagues on this call and elsewhere, so I have access to good, reliable medical information. Similarly, we provide our clients with clear advice on what's going on from a security risk perspective, so we can see where we're operating from a high level picture, but then also right down to the individual traveller. So what are the kind of risks to an individual traveller or an individual employee returning to the office for the first time. So understanding what both the medical and security risks are from an operational, high level, country level perspective, all the way down to being able to support an individual traveller or worker returning to the office. So my advice is absolutely revisit escalation plans because they may not be as relevant in the current environment as they used to be, and also really focus on providing reliable access to information.
Super. Sally, thank you very much. Well, to all of you, thanks very much for attending this week's update on COVID-19. To our international experts, thanks very much for coming on and joining me today and giving your guidance and advice around challenges and recommendations. I would reinforce the fact that your employees have the opportunity to go to the internationalsos.com website. We have a COVID portal within there that has a wide variety of information, both on the current situation as well as the travel advisory situation. And there is a country by country review available for members to access that information to help prepare them for that right travel. Do join us again on future sessions. Hope this has been useful and wishing you all a very good week ahead. Thanks very much. Bye-bye.